ROI is the award-winning supply chain and logistics provider of the Mercy Health System, with its centralized distribution center located in Springfield, Missouri. It's one of the most sophisticated transportation networks in U.S. healthcare today. ROI has a completely integrated logistics operation that touches every aspect of the Mercy Health System's hospitals, clinics, and associated practices. ROI provides over 30 transportation services, including supply chain of medical surgical supplies and pharmacy, a courier operation of clinical service items such as patient specimens, records, mail, linen, receipts, and many others across the health system and inside Mercy's 30-plus hospitals. Success begins in the warehouse.
Within our warehouse, after our pickers pick the product, then logistics starts at the sorting of the pallets. So you sort the pallets for downstream or the delivery to our hospitals or our customers. And once the sorted of the pallets, then you build those pallets, and then you're going to load them into our vehicles and our trailers, and then ultimately it's going to be delivered downstream to our customers or our hospitals. There's a lot of value within our warehouse. One item would be allowing us to have full visibility of real-time data. So that way, that real-time data allows us to improve our customer satisfaction, so we can react real quickly if we need to know where something's at for patient care. Also allows us to reduce costs through standardization. And that means that everybody's doing the standard process, sorting a pallet, loading a truck, delivering the truck through technology.
The supply chain to the hospitals is a finely tuned machine.
Throughout Mercy, we have 36 hospitals that we have a supply chain network. Once the pallets arrive at the hospital, they're already prepped for ultimately, potentially delivering directly to the floor. Also at the hospital dock levels is a sorting process. So the scanning of each item shows us for proof of delivery, proof of pickup, proof of putting on a cart, and then it's going to be delivered in a workflow. So we have internal routes through our technology, just like our courier routes, just like our truck that left at the DC and delivered to our hospital. Inside the hospitals, we have a workflow of delivery through technology. It's all about, working through standardization of process.
The courier operation standardizes many complex tasks.
Our comprehensive network is tied together by our courier network, because ultimately we still got to get the deliveries to our clinics. We talked about hospital, but we also got our family doctors. Now we're getting to the point where we're getting closer to patient care within our courier network. So we're delivering supplies, we're delivering x-rays.
At the warehouse, the courier collects everything for his route. At the clinic, he follows the exact same routine each time, dropping off the items from the warehouse and picking up items that need to go back to the warehouse or to be delivered to the hospital.
We have mail, we have laundry and linen, multiple items that we track our activity through our technology. It's all about prepping our courier to be set up for success once they get to the clinic with multiple service locations. What I mean by that is that we've got work instructions on our handheld that gives detailed information of what they need to utilize. And then the courier's there every day, day in and day out, same routine, same path in the clinic. If they've got the same routine day in and day out and utilizing that technology, and they deliver the supplies first, they go and pick up the mail, picking up patient specimens, which is the most important thing we move throughout our courier network, is our patient specimens, because that affects a patient's health.
The courier picks up items for many other locations also, the most important being the patient specimens going to the lab, but also receipts going to the bank, for example.
So through technology, we're able to track all this activity that we just mentioned, which ultimately, again, brings us back to standardization of work, standardization of workflow, but our couriers ultimately are delivering our different types of services more than just supplies from our DC.
Using technology, ROI's transportation team seamlessly integrates the warehouse, the hospital, and the courier services into a well-designed and well-managed holistic delivery network, bringing world-class logistics to the entire Mercy Health system.